Come in.
Good evening, ma'am.
Good evening.
I am Sari Charity Dumaliu from Holy Trinity University, and I am your student nurse for today. Can you state your name for me, ma'am?
Irene Joy Perez.
Okay, how do you want me to call you, ma'am?
You can call me Irene.
Okay, Miss Irene. So for today, ma'am, I'm gonna be conducting a physical assessment on your cranial nerve in order for me to know if there are any abnormalities behind it po. And in conducting this procedure, I will need for your consent if it would be okay for you if I will touch certain parts of your head and your shoulders, ma'am.
That's okay.
Okay. So assuming that I have already done medical hand washing, I am now performing hand hygiene. How are you feeling right now, ma'am?
So far so good.
Okay. So wait for a moment, ma'am. I'm just gonna wear my gloves so that we can begin with the procedure. Okay, ma'am. So now I'm gonna be starting from cranial nerve 1 or the olfactory nerve, and in order for me to assess that, ma'am, I want you to close your eyes for a moment. Okay, so I'm just gonna put something in front of your nose and I want you to identify the smell, ma'am.
Calamansi.
Okay, so you have identified that smell, ma'am, which means that the olfactory nerve is intact po. Now, ma'am, I'm gonna be proceeding with cranial nerve 2 or the optic nerve. So I'm just gonna check for the confrontation visual field. So ma'am, I want you to cover up your left eye for me. Okay. So I want you to focus your eyes on my eyes, and as I move my fingers, I want you to identify if how many fingers I am moving based on your peripheral version, ma'am. Okay.
2, 1, 2.
Okay, so the other eye, ma'am.
3, 1, 4.
Okay, so you have said that clearly, which is actually accurate and precise, and you have guessed it right well, based on your peripheral version, which means that your cranial nerve 2 is intact po. And now, ma'am, for the continuation of cranial nerve 2, I want you to stand here and face the Snellen chart so that I can test for visual acuity. So, ma'am, I want you to cover up your right eye so that I can assess with your left eye. Okay. So, ma'am, I want you to read these letters starting from E, F, P, T, O, Z up to down. Okay.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, T, F, D, P, L, T, C, E, O.
Okay. What color is this now?
Green.
This one?
Red.
Okay. So, ma'am, your other eye po. Okay. Start again.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, T, F, D, P, L, T, C, O.
Okay. Now, ma'am, both eyes po.
Cover.
No, ma'am, both eyes.
Okay,
Open
eyes.
po. Yes, ma'am.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, T, F, D, P, L, T, C, O.
What color is that, ma'am?
Green.
That one?
Red.
Okay, so that nerve is intact po. So, ma'am, you can sit again now. So now, ma'am, for cranial nerve 3 or the oculomotor nerve, ma'am, I'm gonna be holding this pen light 12 inches away from you, and I want you to focus on this pen light as I move it in a 6 cardinal fields of gaze po. Okay? Okay, ma'am. Okay, based on my observation, that nerve is intact po. So now, ma'am, I'm gonna be proceeding with cranial nerve 4 or the trochlear nerve. So I'm just gonna dim the light a little bit. Okay. So, ma'am, I want you to focus on that distant object. Okay, focus lang po. So I'm just gonna shine this a light from each side of your eyes to see the constriction. Okay, it's constricted. The other eye. Okay, so the result is the same. Okay, ma'am, your cranial nerve 4 or your trochlear nerve is intact po because based on my observation, your iris is constricted po. So now, ma'am, I'm gonna be continuing with cranial nerve 6 or the abducens nerve po. And ma'am, I want you to focus on this pen light. Okay? Keep your head still po as I move this closer to your eyes, okay? Okay. Okay. So based on my observation, there are no signs of any strabismus and anesicoria, which is good, no? So, ma'am, based on my observation on your optic nerves or the nerves in your eyes, your pupils are equal, round, and reactive to light accumulation po. So now, ma'am, I'm gonna be assessing you for cranial nerve 5 or for the trigeminal nerve po. So, okay, ma'am, can you bite down for me? Mm-hmm. So I'm just gonna feel your muscles here. Okay, it is intact. Your temporal lobe. Okay, it is intact po. Okay. So now, ma'am, I want you to open your mouth against the resistance of my percussion hammer. Would that be okay? Okay, ma'am, again. Okay. So you did that with ease. So, in pertaining to that, your cranial nerve 5 or your trigeminal nerve is intact, ma'am. Now, ma'am, I'm gonna be assessing you for cranial nerve 7 or your facial nerve check po. So, can you close up your eyes for me tightly and open them up? Okay. So now, ma'am, I want you to smile for me. Okay. Front. Okay, ma'am. I want you to pop out your cheeks for me, ma'am. Okay, sir. Okay, ma'am. So you did that easily, which is actually good, and that only means that your cranial nerve 7 or your facial nerve check is normal. But now, ma'am, I'm gonna be assessing you for cranial nerve 8 or the vestibulocochlear nerve. So I will just occlude one of your ear for the first one. So, ma'am, I'm gonna whisper something on your ear, and I want you to identify the sound and say that out loud, okay? Banana fish.
Banana fish.
Okay.
Banana sundae.
Okay. So you were able to identify the sound, which means that your cranial nerve 8 is normal po. Now, ma'am, I'm gonna be heading to cranial nerve 9 or your glossopharyngeal nerve. So in order for me to assess that, I'm gonna use a tongue depressor. So, ma'am, can you open up your mouth for me? Okay, I'll wait. I forgot to use my fan light. Okay. Okay, open them up. Can you see? Okay, so your ovula move. Now I'm just gonna check for any, what do you call this? For gag reflex, ma'am. Okay, so I'm just gonna push it here a little bit. Okay, 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 ma'am. So based on my observation, ma'am, your cranial nerve 9 or your glossopharyngeal nerve is intact po. And based on my observation, ma'am, for cranial nerve 10 or your vagus nerve, it is intact po because you were able to talk without hoarseness and you were able to swallow po. Now, ma'am, for cranial nerve 11 or your accessory nerve, I want you to move your head side to side. Okay. up and down. Okay. So, ma'am, I want you to shrug your shoulders against my resistance. Okay. Okay. Okay, po. So, ma'am, for cranial nerve 12, or for the last part, or the hypoglossal nerve po, can you stick out your tongue for me? Okay. Move it side to side. Okay, ma'am. So, it is intact po because you were able to do that with ease. So, ma'am, based on my observation, there is no any signs of abnormalities underlying on your cranial nerves. So, do you have any other question, ma'am?
None so far.
Okay. So, if you don't have any other question, ma'am,